Italian coronavirus index patients in Lagos attempt to escape from quarantine. The corona patient attempt to escape Lagos isolation center over poor facilities, excessive heat, mosquitoes. Government searches for over 200 Nigerians contacted by Italian. Lagos tracks 120 other passengers on Turkish airline flights with patients. 28 workers quarantined in Lafiagi's Ogun Fortress. Face mask and sanitizer sales so. Following the detection of the first case of the novel coronavirus disease and the placing in quarantine of the patient, qualified as a 44-year-old Italian at the Infectious Disease Hospital in Yaba, Lagos, a health worker at the mainland hospital Yaba said on Friday that the patient was angry and attempted to escape, given the state of the isolation center. The high-ranking health worker, who spoke to our correspondent on the condition of the animosity on Friday, and decreed that the very poor quality of the isolation center, lamenting that the authorities have not matched words with action. Deputy Governor of Lagos State, Obafemi Hamzat, had said on Friday that the state government had built a facility to handle the situation, adding that the patient was getting better. He said it is a lab that we built that was and can accommodate 100 for now, but it is only one bed that is occupied today. Hopefully, it wouldn't spread. This virus will never spread. The patient is there and he is getting better. It is steady. The doctor says he's going to be fine. But the health worker told our correspondent that the coronavirus index case had been very upset about the surrounding, adding that the patient complied on excessive heat and mosquito. He also complained that he can no longer stay in the hospital because of mosquito and heat. In an interaction with our correspondent, the health worker, who did not wear any personal protective equipment required of workers in such an environment, said that the patient wanted to run away yesterday on Friday, that the Italian man, who seems to be an engineer, was very angry, that the room where he was kept was very hot. There is nothing there inside the isolation wards aside from bed and hospital locker. He almost ran away and is still threatening to do that. The source said that the level of preparedness in Lagos for infectious diseases such as coronaviruses and Lassa fever is zero. It is very sad that a country like Nigeria is never ready to medically contain infectious disease outbreak. This is why most health workers leave, because they are predisposed to danger of infection. According to the source, the mainland hospital does not have a ready and designated facilities to associate and isolate threats, Lassa fever patients, much less coronavirus. The source noted that the place earmarked for Lassa fever treatment had yet to be completed. The source said that the place meant for the Lassa fever patients has been under construction in the past 1 month. It is only yet completed. As you can see, they are makeshift constructions, hurriedly put together with white capulum. They are not permanent, and I don't know how this place can actually accommodate humans that have a highly infectious disease like Lassa fever, he said. The health worker noted that despite the fact that the state government had been able to track some persons that had contact with the index coronavirus patients, they could not be quarantined, allegedly because the state lack requisite facility. The source added that the standard medical operational procedure is to track all contacts and have them quarantined to avoid further spread of the virus. But we cannot do that because we lack such facilities, which is why there is emphasis on self quarantine. An online entry described the mainland hospital where the Italian is being quarantined as an ultra-model multi-drug residence tuberculosis treatment center with a 40-bed admission facilities. Our source, who emerged from the outpatient department of the mainland hospital Yaba, alleged that Lagos State did not have the facility to accommodate individuals who might have come in contact with the Italian. According to the source, the facilities that is meant to accommodate both suspected and confirmed coronavirus cases is still undergoing renovation and might take a while before it can function fully. He also revealed that the isolation area was a room in one of the wards and it was quickly vacated to accommodate the index case. The source alleged that the only thing demarcating the room from other rooms is the word is a red and white barricade tape. That is where the Italian man that tested positive to the virus is kept. That is no single equipment inside that place. It is just like any other regular hospital with a bed. That building you see that is being repainted in the original place meant to quarantine coronavirus patients. As you can see, the place is not ready. The state government is just renovating it. Despite the fact that the virus started spreading since December 2019, it is really sad that a country like Nigeria is never ready to medically contain infectious disease outbreak. This is why most health workers leave because they are predisposed